Welcome to the Gorilla Health Report, where we put the medical profession in the paper gowns and deliver health news from an alternative perspective. We're streaming to you from the interweb and featured in clinics across the nation. I'm your host, Doc Edwards, and these are your top stories. Clinical trials are an important part of the process of drug testing and approval in the U.S. and, perhaps naively, we tend to assume that they are conducted in an objective and representative way. The latest research by an oncologist from the University of Michigan Medical School shows that women are particularly underrepresented in clinical trials related to cancer studies. JAGC evaluated hundreds of studies, including more than 500,000 participants, and found that 75% of these studies underrepresented women. This is a worrying result, given that differences in male and female physiology can affect the response to some drugs. Without proper studies that differentiate male and female responses to such drugs, the effectiveness of their use may be seriously limited. Studies of the response by children to many drugs are also conspicuously absent in many clinical trials, and this is another cause for concern in the way that these drugs are prescribed for children. Research is showing that women don't fare much better when it comes to medical treatment during breastfeeding either. The relationship between medications and breastfeeding is an incredibly important and often overlooked aspect of health in postpartum mothers. In 2006, a booklet called Medications in Mother's Milk by Thomas Hale was distributed by the Rhode Island Department of Health to the pharmacists statewide to educate pharmacists about medication recommendation for breastfeeding mothers. This was recently followed up by a survey of these pharmacists in order to assess how they were using the information. Unbelievably, the results of the survey showed that 58% of the pharmacists never asked women if they were breastfeeding before supplying them with prescription and non-prescription drugs. Not only that, but 85% of the pharmacists reported feeling uncomfortable about giving advice to breastfeeding women. Although most all said they consulted the book at least monthly, the lack of information reaching breastfeeding mothers is clearly a serious issue. And these were pharmacists who had the information available to them in a booklet. What about those pharmacists who are not in the Rhode Island area and do not even have this much information? With available medications changing constantly, you would think it would be essential that pharmacists have up-to-date information about how these can affect breastfeeding mothers so they can make informed decisions about whether or not to continue to breastfeed while they're on medication. Well, we at the Gorilla Health Report certainly couldn't bring you information like this without your support. I'd like to thank Dennis Mengelt from www.crobbies.com, Aaron and Nancy Brooks, hailing from Pecatonica, Illinois, and Dr. Samantha Wilson in Milwaukee for joining the Rula Nation. To sign your clinic up or for show notes on today's program, visit us at www.gorillahealthreport.com.